fentanyl addiction. Fentanyl topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids including heroin or cocaine. Non-opioid illegal drugs such as marijuana, methaqualone may be legal in some states. And the prescription opioids including OxyContin or oxycodone. Fentanyl is a synthetic opioid. And non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids including OxyContin, fentanyl, due to a severe pain. How it works? Fentanyl might block the pain by opioid receptors on nerve cells. And the pain symptom, a disease. For example, is that might cause symptom. You may have after a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or oxycontin addiction or dependence, they start fentanyl. Maybe more convenient and it might be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer. Purdue Pharma had prescription treatment the fentanyl batches from 25 to 100 microgram per ounce. Fentanyl 25 to 1 microgram per ounce equal to every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine. So lethal dose is about 2 milligrams or 2,000 micrograms. Many tablets or pills from these illegal micrograms found milligrams. One tablet contains more than 2 milligrams. It's enough to kill a person who took that tablet. Fentanyl dependence or addictions can be physical or psychological. Addiction means you want the same feeling give you effect a good feeling, continue having that feeling. It means it is overdose because you want that or better feeling. So you want to have, so it's easy to get overdose. When people get, can be that addiction or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. Who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you have drug dependence or Fentanyl can be very dangerous. If you have any further, let me know in the comment below. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so you continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs, such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription, including OxyContin, oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin issue lawsuits to the manufacturer who do pharma. A lot of people will die because of the OxyContin long extended relief effects, overdose. The manufacturers had to file a bankruptcy, and now it renamed as Nora Pharma. So when the OxyContin supply has problems, the cartels take some advantage about that. They start produce the illegal drug, the heroin. Who have OxyContin abuse, they are a heroin because this illegal drug is cheaper but for stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid dependence or OxyContin addiction. OxyContin is an opioid. Some legal opioid, heroin, cocaine, illegal non-opioid drugs such as marijuana, methaqualone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin U4. OxyContin is the brand name for the oxycodone. It is extended release, so it can last for 12 hours. It's used to treat a severe pain. How it works? The oxycodone might block the pain by binding to the opioid receptors. So what is just a disease? A disease may be an arthritis. For example, arthritis is a disease that may cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication. Tylenol, Motrin, the research shown before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from doctors who prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. The opioid abuse may lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid gives you. The opioid effect or the OxyContin effect, it gives you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you have drug or opioid dependence or addiction to monitor and to decrease the drug addiction. Some states have drug monitoring programs to the prescriber or doctors opioid medications. So the best thing the content content such as for every or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you have this non-opioid pain relief medication, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. Fentanyl addiction. Fentanyl is the hot topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids including heroin or cocaine. Non-opioid illegal drugs such as marijuana, methaqualone. Marijuana may be legal in some states. And the prescription opioids including OxyContin or oxycodone. Fentanyl is a synthetic opioid. And non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids including OxyContin, fentanyl, used to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that may cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, Soma before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or oxycontin addiction or dependence, they start using the fentanyl. Maybe more convenient and it may be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equal to OxyContin 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligram or 2,000 microgram. Many tablets or pills from these illegal migrants found more than 2 milligram. So one tablet contains more than 2 milligram. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdose because you want to feel better and better. That feeling. The same or better. You want to, it's easy to get over. Can be addiction or may drug may not them psychologists who have to really need seek good treatment. You think and you want to have the same feeling the opioid give you. The opioid effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs, such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription opioids, including oxycontin or oxycodone, fentanyl, is stimulant. The last after they have heart due to the oxycontin issue lawsuits to the manufacturer who do pharma. A lot of people will die because of relief overdose. The manufacturers had to file a bankruptcy, and now it renamed as Nora Pharma. So when the oxycontin supply has problems, the drug cartels take some advantage about that. They start produce the people who have the oxycontin abuse, addiction, dependence. They are looking, they are start using heroin. They are start using heroin. Drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid Heroin addiction. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so you continue having that feeling. It's addiction. Heroin is an illegal opioid such as cocaine. Other non-opioid drugs such as marijuana, ethaquone. Marijuana might be legal in some states for medical treatment. And prescription opioids, including OxyContin or oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin issue lawsuits to the manufacturer, Voodoo Pharma. A lot of people will die because of the OxyContin long extended relief effects, overdose. Manufacturers had to file a bankruptcy, and now it renamed as Nora Pharma. So when the OxyContin supply has problems, the drug cartels take some advantage about that. They start produce the heroin. The people who have the OxyContin abuse, addiction, for a alternate drug, they start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to crimes, you should seek a medical treatment if you think you have drug or opioid dependence or addiction. OxyContin addiction. OxyContin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methaqualone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin used for? OxyContin is the brand name for the oxycodone. It is extended release, so it can last for 12 hours. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease may be an arthritis. For example, arthritis is a disease that might cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. The opioid abuse might lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling opioid give you. The opioid effect or the OxyContin effect, they give you a good feeling like high, so you continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to decrease the drug addiction, some states have prescription drug monitoring programs to monitor the prescribers, the providers or doctors who prescribe opioid medications. So the best thing to avoid OxyContin addiction, you should take OxyContin when it's indicated, such as for severe pain after a surgery or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you don't have this side effect. You may use non-opioid pain relief medication, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. Fentanyl addiction. Fentanyl is the hot topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids including heroin or cocaine. Non-opioid illegal drugs such as marijuana, methaqualone. Marijuana may be legal in some states, and the prescription opioids including OxyContin or oxycodone. Fentanyl. Fentanyl is a synthetic opioid, and non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids including OxyContin, fentanyl, used to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or oxycontin addiction or dependence, they start using the fentanyl. Maybe more convenient and it may be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equal to OxyContin 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligram or 2,000 microgram. Many tablets or pills from these illegal migrants found more than 2 milligram. So one tablet contains more than 2 milligram. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so you continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. So people who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction can be very dangerous. You have any further questions? No. Hello. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heartbeat. Sometimes your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with, then you may be on a platinum medication for the rest of your life, unless your cardiologist can convert your heart. That's very rare. Sometimes people have AFib, but they don't start the platinum medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the blood thinner medication yet. They may put you on maybe aspirin. So when you have a AFib, your doctor need to select one of the oral blood thinner medication. If your AFib is not regular, you may start with the Eliquis, Xarelto, or Badaxa for your convenience. You don't have to do the frequent monitoring like warfarin. If your AFib is regular, then you have to take warfarin. So it is depends of your AFib, and your doctor might the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. deficiency treatment duration. What is factor V latent deficiency? Is a blood disorder. It is one of hyper. There are two types of latent deficiency. First one is factor V latent deficiency. This is my single of having blood clot. If you don't have any blood clot, your lung, you may not need the medication yet. If you do have a blood clot in your left history, you may need to take medication such as for 6 to 12 months. Type of latent defect is heterozygous, major or multiple risk of having blood. If diagnosed with this type of factor V latent deficiency, then you take a blood thinner indefinitely, regardless of having a blood in the past. The best indication is there are ongoing study for the other conditions, such as ADAXA for this patient. If you have any further question, please let me know in the comment box below. Antiphospholipid antibody syndrome, AAS, or lupus equivalent. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is hypercoagulable stage. People may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antibody syndrome or lupus, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Coumadin. You should avoid taking Eliquis, Hiroto Adaxa. If you have any further question, please let me know in the comment box. Thank you. If you have rheumatic mitral valve disease, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take the blood thinner medication for the rest of your life or indefinitely. And the best medication for this condition is warfarin. If you have a history of rheumatic mitral valve disease and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have a question, please let me know in the comment box below. Thank you. pulmonary embolism, or PE. What is pulmonary embolism? It, it is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a blood clot in your lung or the cause of the clot, may initiate for about 3 to 6 months. If that is the first time you have a blood clot lung, if you don't know the cause, don't know why clot in your lung, and if that you have a you have to take a blood thinner medication for 6 to 12 months. If you have a second time in your lung or clot in your lung, then you may need to take definitely or for the rest. You have a blood clot in your lung. That recurrent blood clot need to take a blood thinner medication indefinitely or for the rest of your life. If the blood clot at high risk for your recovery, then you may need to take a blood longer, maybe for the rest of your life, or definitely. Finally, if you have and it's related to active cancer, then you may need a blood thinner medication until you know cancer, and at least so you have to take a blood thinner medication for 3 months, and you no longer have active. Further question about this, leave in the comment box below. Thank you. deep vein thrombosis or DVT. What is thrombosis? Deep vein thrombosis, a blood clot in your leg. So you have to be on a blood transfusion if you have a deep vein thrombosis. You have to take a blood thinner medication 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in life, if you don't know what is the cause of the blood clot in your leg, then if that is the first time you have a blood clot in your leg. If you have a second time of blood clot or recurrent blood clot in your leg, then you may need to take a blood thinner medication indefinitely or for the rest of your life. If the cause of blood clot in your leg because of an active cancer, then you need to take a blood thinner medication until you no longer have a cancer. This is the general information for how long you need to take a blood thinner medication if you have a blood clot in your leg or a deep vein thrombosis. If you have any further question, please let me know in the comment box below. Thank you. mitral heart valve treatment duration. If you have mechanical mitral heart valve, you might need to take a blood thinner medication for the rest of your life or indefinitely. The best medication for your mechanical mitral heart valve is warfarin. If you have a bioprosthetic or tissue mitral heart valve, you might only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. This is the general information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist's instructions, including treatment duration. If you have any further question, please let me know in the comment box below. Thank you. transient ischemic attack, TIA, or mini stroke treatment duration. So the duration, it could be clinical adjustment. So it depends. After the TIA, you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will how long you have to be either on aspirin or warfarin. Generally, people take aspirin to prevent another TIA. For some people, they would have to take an anticoagulant, such as warfarin, to make sure they are safe from the transient ischemic attack, TIA, or mini stroke. If you have any further question, please let me know in the comment box below. Thank you. aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a platinum medication indefinitely for the rest of your life. The best medication often. If you have bioprosthetic aortic heart valve or tissue aortic heart valve, then you may need to take a platinum medication for about 3 months, and then you take aspirin for the rest of your life. This is general information for how long you have to take a platinum medication. You have aortic heart valve. Your cardiologist will tell you exactly how long you have to be on a platinum medication or an aspirin. If you have any further question, please let me know in the comment box below. stroke and blood thinner medication treatment duration. So if you have a stroke and you have to take a blood thinner medication, you know how long you have to be on a blood thinner medication. So your stroke because of embolic causes such as atrial fibrillation or heart valve, then you have to take blood thinner medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, then you don't have to take a blood thinner medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide what is the best treatment therapy and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. dilated cardiomyopathy treatment duration. If you have dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a blood thinner medication for the rest of or indefinitely. If you have dilated cardiomyopathy and left ventricular or LV thrombus, may need to take a blood thinner medication for at least 3 months. The best blood thinner medication is warfarin. So if you have a history of, and now you have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a blood thinner medication indefinitely for life. If a of dilated cardiomyopathy, and now you have a left thrombus, then you may need to take a blood thinner medication for at least 3 months. Best blood thinner medication is warfarin. You should follow instructions on therapy. If you have any further questions, know in the comment box below. Thank you. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heartbeat. Sometimes your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you may be on a platinum medication indefinitely for the rest of your life, unless your cardiologist can convert your heart back to normal. But that's very rare. Sometimes people have AFib, but they don't start the blood thinner medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the blood thinner medication yet. They may put you on baby aspirin. So when you have a AFib, your doctor need to select one of the oral blood thinner medication. If your AFib is not regular, you may start with the Eliquis, Geroto, or Badaxa for your convenience. You don't have to do the frequent monitoring tests like warfarin. If your AFib is regular, then you have to take warfarin. So it is depend on what type of your AFib, and your doctor might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it might cause a clot disorder or blood clot risk. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, dabigatran. antithrombin or AT deficiency treatment duration. This is the blood clot disorder or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot in your leg or your lung. The best medication for this indication is warfarin. If you have any further questions, please let me know in the comment box below. Thank you. All right, the next topic I want to talk is Eliquis versus Pradaxa or dabigatran. So I have a similar indication. FDA approved for stroke prevention in non-valvular AFib, inner thromboembolism treatment for prevention. Precaution. The Eliquis should be used in precaution when the creatinine clearance less than 25 or the serum creatinine over 2.5. Typically, we use the Eliquis with a lower dose when people have this level, creatinine clearance less than 25 or serum creatinine greater than 2.5. For Pradaxa, we should avoid when creatinine clearance less than 30. And it's not recommended to start in patients with creatinine clearance less than 50. So creatinine clearance at 60 or above is considered when it's less than 60, it's not normal. And then when it below, when creating clearance below 50, then we should not start Pradaxa. And this medication contraindicated with patients who have mechanical heart valves, liver disease, active hepatitis, cirrhosis, significant LFT elevation. When people have the AST or LFT greater than 2 to 3 of their upper limits, then we should not Aliquis or Pradaxa. Pregnancy, people who are pregnant, they should be avoided taking this medication, Aliquis, Pradaxa. The side effect, Aliquis is better in terms of stomach bleed or GI bleed. Pradaxa might increase the GI side effects. So people who have stomach problem like peptic ulcer or the colitis or something like that, they should avoid taking Pradaxa. Dosing, the Aliquis and Pradaxa have similar dosing. They take they should be taken every 12 hours or twice a day. For the feeding tube, Pradaxa is not recommended. The Pradaxa dosage form available in capsules. So the capsules cannot be crushed or opened. Capsules must be capsules of the Pradaxa, but be in original container for about when it's open, it's only good for 3 months. Maintenance there is and it's over 3 months. The medication no longer the if we open the container use this medication 3 months. With that, I don't recommend people to use the bubble bag. For some hospital patients, they need to have the bubble bag and then this medication must store in the original container to protect from the light, and they should not be used in the bubble bag. The Pradaxa do not have interaction with the CYB384 drugs. It has a little bit different with the drug interaction. The Aliquis had antidote or reversal agent is called the andexanet alpha or andexa. The Pradaxa antidote is Sizumab or Respite. So they have different antidotes or reversal agents. So generally, Pradaxa is less common than Aliquis. Pradaxa generally used for those people who have the good renal function and they are young. Otherwise, Aliquis should be started, in patient have the increased risk of bleeding, have stomach problems like peptic ulcers or GI bleeding, and have renal function problems. And the big disadvantage of the Adaxa compared to Aliquis is the Adaxa cannot be used in the bubble bag setup for the hospital patient. Yeah, the patient who need to use the bubble bags for their medication for all of their medication. All right, have any further concern why we choose the Aliquid or why Adaxa versus Aliquid? Please let me know in the comment below. Thank you. Today I'm going to talking about the Aliquid or Abiciban versus Geroto or rivaroxaban. So how do we know which one is better? How do we know how to choose one of these medications for our patients? So first, these medications have similar indications. FDA approved for stroke prevention in non-valvular AFib or atrial fibrillation, and the venous thromboembolism treatment for prevention for different thrombosis or DVT or pulmonary embolism PE. So first we need to look at the renal function to choose this medication. Generally, Aliquid is better for people who have renal impairment or renal dysfunction. Most of the elderly people who over 80 years old do have renal problems, So we should start or initiate Aliquid instead of Geroto for patients over 80 years old. Aliquid, we need to use precaution when serum creatine clearance less than 25 or serum creatine over 2.5. For these patients with significant renal dysfunction, we need we need to monitor closely, especially we need to test kidney function, the renal function, to make sure patient has no bleeding. For people who have the creatine clearance less than 25 or serum creatine over 2.5, you might need to reduce the dose to 2.5 milligrams twice a day instead of 5 milligrams twice. For Geroto, we should avoid patients creatine clearance less than 30. So I just mentioned should not start Geroto for patients over 80 years old who have some kidney function problem. This medication generally absolutely contraindicated in patients who have mechanical heart valves, active liver disease like active hepatitis, severe cirrhosis, or significant LFT elevation. If the AST or the the AXT or the ALT over 2 to 3 times their upper limit, then you should not use this medication. Pregnant should not use this medication. For the side effect, the most concern and common side effect is bleeding. So the Eliquis is better than Xarelto for the stomach or GI bleed. So people who have concern about stomach bleeding or they have some kind of stomach problems history, then we should start with the Eliquis versus the Xarelto. Dosing, the Xarelto might be advantage compared to Eliquis because Eliquis is taken every 12 hours or twice a day, but Xarelto take once a day or every 24 hours. But it's must take with a full meal, full stomach. So there is one advantage of the Xarelto compared to the Eliquis because it's take once a day instead of twice a day. For people who have problem to remember taking the medication, then they might start with Xarelto if they don't have any other issue like bleeding risk or kidney problems. For some patients, they need to use the feeding tube, and probably the Eliquis is recommended. These medications, they have similar drug interaction. They should avoid the some inhibitors medication, like CYB 384 and GP substrates. So CYB 384 inhibitor and EGB substrate. They have similar antidote or reversal agent. The andexanet alpha or andexa, the brand name. So generally, the Eliquis is recommended more than the Xarelto. Only a few or some patients want one daily dose, then they want to start with the Xarelto. You let me know if you have any question on these two medications. Thank you. Talking about the Eliquis versus warfarin. So why you will see some people take Eliquis or Adixaban versus warfarin? When you go to Google and you just search for it, Eliquis versus warfarin, you will have about 600,000 results. Okay, so
Aliquis versus warfarin or vice versa. So the first one from myhealth.net, they say Aliquis is shorter acting than warfarin. Excuse me. So Aliquis is shorter acting than warfarin, and the blood thinner effect is quicker gain or loss after about 24 hours. Aliquis rarely require bridging because it is shorter acting and can be safely stopped a day or two before any surgery. So it's Aliquis image and the warfarin image here. It's not always the case. It is just general information. I've been working for the Anticoagulation clinic for many years. So yes, Aliquis, you have to take one twice a day. Whereas the warfarin or Coumadin, you take one tablet, one dose a day. So it have a longer half-life, and it take a longer time to get to the peak effect and get into stable state. So usually warfarin take 3 to 5 days to start working in your body when you just start warfarin, and then you take 1 to 2 weeks to get to the peak. Like the peak, and then become a stable state after 2 weeks or so. Aliquis is just similar to the low enough injection or enough suffering injection. So Aliquis is the fifth dose medication. Either take 5 milligrams twice a day or 2.5 milligrams twice a day for certain patients. So it works every 12 hours medication. You should take same time every day, every 12 hours, and then the warfarin the same time every 24 hours. Aliquis compared to warfarin, Aliquis, even though you have a co-pay, it is very expensive, like $500 per month, and about 1,000 or more for 90-day supply. Warfarin is like $10 for 3 months or so it's very cheap. Aliquis is a new medication. I think it's available since 2018 or so, 2017 until now. It's been studied, and it shows that the Aliquis is effective, just like warfarin. And for elderly people, it may be convenient. They don't, have to go with the confused dosage with warfarin. Aliquis just take 1 tablet, fixed dose twice a day. So it may be best for a lot of patients, especially elderly people. Warfarin is very complicated in dosing. Some days they take 1 tablet, some days they take half tablet. It's a weekly dose, but you have to take every day. It sounds very complicated. Another advantage of Aliquis is diet. Might be affected by the vitamin K foods like greens, vegetables like kale, cucumbers, spinach, broccoli, things like that. Might affect warfarin. If you eat more vitamin K food, it may make the iron level go down. And if you eat less vegetable, it makes the iron level go up. So you must be stable with vitamin K foods every day. Aliquots is not affected by vitamin K foods, so most of people happy with that. They don't have to watch for their diet. And another advantage of aliquots compared to warfarin, aliquots doesn't require close monitoring. Okay, some people, if you are over 75 and you have normal kidney function, normal liver function, you only required to test your blood, every 6 months. And then for warfarin, you have the maximum they can extend the follow-up is 6 weeks. Okay, so 6 weeks you need to come back to get the iron test, your blood test, to make sure your warfarin level is not too high, not too low. When low is meaning you don't have enough warfarin in your body. When iron too high, it means you have too much warfarin in your body. It's making heart bleeding. So that's why they have to test your iron level frequently. If you are stable, your iron very stable, then you can in 6 weeks. But if your iron level is not stable, you have to come back frequently, like weekly or 2 weeks or 3 weeks, depending on your iron level. If your iron level is critical, it means it's too high, like 5.0 or 6, then you might need to hold warfarin and come back in 3 days or 2 days, things like that. But an aliquot is not frequent follow-up or test. No test required to make sure the aliquot is enough in the body. No, we don't have that test. That test is very expensive and it's no required. For the side effect, somehow, and then for elderly patients, aliquots may be better than warfarin because they don't confuse. They are not confused with the dosage. So if they take the aliquots with the dropping dose, then probably. But for warfarin, sometimes they confuse with the dose, and then they may take a wrong dose, and it will cause bleeding. That's one reason. The second, they understood the aliquots may be better in terms of stopping bleeding, to warfarin for the elderly patient. And then the aliquots is it's just like low enough injection, so you don't have to be rich before the surgery because you may only need to hold for 2 days prior to the major surgery or procedure. But depending on the kidney function, if you have a bad kidney function, then you need to hold more than 2 days, like 3 or 4 days, depending on your kidney function, And the aliquots, they only need to monitor the side effect, which is they need to bleeding. So they need to test your complete blood count to make sure it's not too low. If the hemoglobin too low, it means you might have some kind of internal bleeding. Then you need to pay attention on aliquots, and then you need to go to see a doctor, the stomach doctor, to make sure it's not caused by the aliquots. And then you need to check your when you're on blood thinner medication. You need to check your stool and your urine frequently to make sure any kind of bleeding. check your skin to see if any abnormal bruising. Those things that you need to pay attention, and you need to avoid any physical activity that easily cause fall. So those things need to be careful when you're on any kind of blood thinner medication. So Eliquis generally is maybe better than warfarin in terms of side effect, and then it's more convenient than warfarin because you know the dose is a fixed dose and they're not required to test frequently, and they're not and the diet, you know, vegetables, greens, do not affect Eliquis. So more convenient, and it might be better in terms of side effect for some people. The disadvantage is it's so expensive. Some insurance, some healthcare insurer, they don't pay for it. So you need to work out with your health insurance to make sure they cover. And if somebody worry about their therapeutic or their how the Eliquis work in their body, how do they want to know, you know, if enough Eliquis in the body or not. So if for some people like that, they may stick with warfarin. They don't want to provide the medication. You know, if not, it does not need the blood test to make sure it's not too low or too high, like warfarin. And some people need to take Eliquis with a lower dose, like 2.5 milligrams twice a day. No people because they over 80 years old and their weight is under 132 pounds, things like that. If they have those two factors, then they require to take a lower dose. If their kidney function, you know, if their creatinine lesser than greater than 2.5, then probably they need to take a lower dose. For certain people, like people on dialysis, they may be not the best candidate for the Eliquis. So, if you have any further question or concern about if you are taking any blood thinner medication, please let me know in the comment below. How to switch from Xarelto to warfarin. You can go to Google again and type in switching from Xarelto to warfarin. We have about 4,500,000 results. So that's a lot, but for the first few results, you can learn how to switch to warfarin from Xarelto. So they recommend that you need to continue Xarelto warfarin. You start warfarin and continue the Xarelto together, overlap for 3 days. So you stop the Xarelto in 3 days. Switching from Xarelto to warfarin. So you start warfarin and then Xarelto, and then stop the Xarelto in 3 days. And so hopefully in 3 days, warfarin. But if the And 3 days, if you test the I9 level is still too low, like 1.2, 1.3, 1.4, and I would continue yellow for 1 or 2 more days and increase the warfarin a little bit to make sure the patient is safe from blood clot. I sure that to tell the patient to remember to stop Yeroto as instructed. Some patient they forgot to stop the Yeroto. So that's the main thing. By the patient, you might call the patient, um, make sure they stop the Yeroto as instructed. Otherwise, may cause bleeding. So usually for the new warfarin start, you check the iron level maybe twice a week, Monday and then the next time Thursday or Friday. So I would recommend that you should, start warfarin and then stop the Yeroto in 3 days. And then you check the iron still too low, then I would recommend continue for another 1 or 2 days. Then adjust the warfarin dose to make sure it's not too high and not too low. And then recheck in about 3 days to make sure patient is not at risk of blood clot or stroke. And then to make sure the patient is not continue taking both medication, the Yeroto and warfarin. Okay. So if the iron is still very low, and probably need to increase the warfarin, make sure to get to the therapeutic level. And have the patient to report any abnormal bruising or increase in risk. Thank you. How to switch from warfarin to Badax? Go to Google and type in switching from warfarin to Badax. You have about 340,000 results. The first few top results, we may have some information. Here, PHARMACIST.com give you a very quick information. So you stop warfarin and start Adaxa when iron less than 2. So this is general recommendation that how you apply if you are from the hospital setting. If you work in the hospital, you might check iron daily. So when is iron less than 2, then you start Badaxa on the same schedule, start the warfarin. And Badaxa is twice a day doses. You take 1 capsule twice a day. How about the outpatient setting? If you check the iron and iron is less than 2, and the patient has the outpatient clinic, and you are able to give the patient the medication, the Badaxa, then the patient can start Badaxa at the schedule of warfarin. Stop warfarin and start Badaxa. But when I'm at the therapeutic level, like between 2 and 3, so you have to wait, like hope for 1 day to make sure I'm less than 1 to 2 days make sure I'm not letting for the patient the that's if the patient need to send the medication to the patient home, if you overnight, it may take one day. And then if the INA is at the therapeutic level, then I need to go 1 or 2 days, make sure INA less for the patient. If the INA at the time of visit is like 3 point above the level, 3.1 to 5, then probably the patient needs to hold more than 2 days, like maybe 3 days. And how about if the INA, above 3.6 or so, then probably the patient needs to add to reject INA, just hold one or a half dose or 1 dose to make sure the INA back to the normal range, and then recheck it for the notice or further instruction. Depend on the INA level and inpatient or outpatient status to best recommendation when doing from open medicine. How to switch from production to orphan, or from a bigger trend to orphan. So go to go, and I've been switching from production to orphan. You have about 400,000 folks. Again, you look at the first few of websites right here. Stop orphan and start the bigger trend when I'm less than over limit of therapeutic range less than 2. PharmaCist.com recommend stop orphan and start the bigger trend when I'm not. So in the hospital setting, you can do daily INA. So you check the INA, it's less than 2, then just stop orphan and start the bigger trend. But how about the outpatient setting? At the time of business, when INA less than 2, then probably you can hold the bigger trend 1 day and then start the Badaxa. If the patient has the medication on hand, then you may, when INA less than 2, stop open and start the Badaxa. If the patient doesn't have the Badaxa on hand, like you need to overnight the medication, and like that, it may take 1 day or so to get to the patient home. So you need to, if the INA at the therapeutic level, then you just hold the bigger trend for 1 day or 2 days prior to the Badaxa. If the INA like 3.2, 3.1 to 3.5, then I would hold open for like 3 days or so to make sure that INA less than 2, then start the Badaxa. But if it's greater than 3.6, I would hold and have the patient come back in 1 week to recheck the INA for further instruction. So it depends on the iron level in order to recommend when how many days need to hold open in order to get the iron analysis or switching for that. All right, so how do we switch from warfarin to Xarelto or rivaroxaban? This one is a little bit different. You can go to Google and type switching from warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. Okay? And for the first few ones, there is some information that tell you how to switch to Xarelto from warfarin. So right here they say from warfarin, stop warfarin and start Xarelto when INR less than 3. You know that for the Eliquis or Bedex, when INR less than 2, but for Xarelto is than 3. Why? Why it's different? Because Xarelto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, the medication lasts longer. And then it take longer time to get to the peak effect. So, when the iron is less than 3, so you stop the warfarin and start Xarelto. It takes some time for Xarelto to work in your body. So that's why they want the iron less than 3 instead of less than. So, and then similar to Eliquis, if the patient had the life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection, like luminol injection. So, when you want to switch from Xarelto to warfarin, and then you might need to consider the luminol injection to make sure the patient don't have any stroke risk or any life-threatening blood clot. But when you switch from warfarin to Xarelto, then you only need to know when the iron is less than 3. But it's different from the hospital patient and the outpatient patient. So in the hospital, you may monitor iron or recheck iron maybe daily basis to make sure iron less than 3 before you start the Xarelto. But how about the outpatient setting? You don't do the iron daily basis. How do you plan for that? For me, when the iron, for example, at the therapeutic iron, then I just tell the patient to stop the warfarin, and I overnight the Xarelto, or I send the patient to the pharmacy window so they can pick up the Xarelto and start the Xarelto next day, the same schedule they are taking warfarin. So when I know the iron therapeutic, then it's between 2 and 3, then I'll say go ahead and start the warfarin for tonight and start the Xarelto tomorrow. And I know the patient will receive the medication at window, or you have the patient tomorrow via the overnight service. And how about if the iron not too low? If it's too low, then I would just say take half the warfarin at their schedule, and then start the Yeroto the next day at the same schedule of warfarin. What happens if the iron not too high? Like 3.5 or 3.5 or 4, or or about 3. So if it is if the INA about 3.2, then I would just say stop the warfarin for 1 day, and then go ahead and take for the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Yeroto. If it's 3.6 or above, like 4, and then stop the Yeroto for 2 to 3 days. But if it's more than 4, then I will have to hold the dose, and I have the patient to come back, in 1 week, and go from there. But I don't. If it's above 4, and I have to have the patient to reject the I9. That's how I switch from warfarin to Yeroto. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. You'll find about more than 300,000 results from this search. But the Topfuse website have some very important information for you. The first one, say converting the Eliquis or Disiband. It recommend start warfarin and stop Disiband 3 days later. So this is correct, but this depends on the warfarin level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay? And the normal warfarin is usually below 0.9 or 0.9. So around that level is no warfarin. The people never are warfarin. But how about if the warfarin level at that time at the baseline very high, like 0.2, meaning 1.2 or 1.3, like that, and you may need to stop at this event maybe days or so. And then the second option, they say maybe stop at this event and then start the Valentoral anticoagulant or the injection anticoagulant. So like Lovenox, and then warfarin at the same time. So for some people, they are very high risk of stroke or high risk of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, if you want to switch to warfarin, then you probably need to make sure warfarin at the therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to into the therapeutic level. In order to make sure that you need to have some form of injection, like local injection, to make sure the patient is not risk having stroke or dangerous blood clot. So that's about what you need to know when you switching from aliquot to warfarin. But you need to make sure you have the baseline iodine, and then based on the iodine level, you may need to make sure when it's safe to stop the aliquots. Maybe 3 days later, if you have normal baseline iodine. If you have high baseline iodine, then you might need to consider to stop the aliquots a little bit sooner. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like low vein of injection, make sure the iodine level at therapeutic before you stop the low vein of injection. Make sure the patient not having stroke or dangerous blood clot, like blood clot in their lungs. Thank you. How to switch from aliquot to warfarin? You can go to Google and type switching from aliquot to warfarin. You can find about 300,000 results for that search. Look at the first few results. The first result is telling you right here, say, converting aliquots or abicipene. So they recommend start warfarin and stop abicipene 3 days later. So basically, it depends on the warfarin level. For example, if INA at the therapeutic level, yes, then you may stop. I'm sorry. If the INA as the baseline is normal, I mean, usually the normal INA is less than 0.9 or so. Is the people who never take the warfarin before. So you basically just start warfarin and stop abicipene 3 days later. But how about if the INA is higher than the normal level as the baseline? So you need to properly, start the warfarin and stop the abicipene maybe 2 days later to be safe for the bleeding risk. It also say that if you need to make sure, for example, if the patient is very high risk of the blood clot, like acute blood clot, they just have the blood clot in their lung, and the blood clot is very critical, dangerous to the patient. The patient should not the INA should not be low, or the patient need to have certain anticoagulant in their body. So for that case, then the patient might need to take the warfarin and the injection, like Lovenox injection. So for that case, yeah, you need to start the Eliquis, and then start the warfarin and the Lovenox together. To start warfarin and Lovenox together from day one for maybe 5 days or more, and then check the INA to make sure the INA levels is at therapeutic, between 2 and 3 or so, and then stop the Lovenox injection and just continue to take a warfarin along. So that's the case that you need to make sure that you how to switch from warfarin to Eliquis. So you can go to Google and type in switching from warfarin to Eliquis or Abixiband. You can find about 400,000 results. But the first few websites help you to understanding how to switch from warfarin to Eliquis or other direct acting oral anticoagulations. So for Eliquis, we'll switch to the Eliquis when the INR are less than 2. So, excuse me. So, for example, if the patient INR is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin about 2 days prior to starting the Eliquis. So, at that time I had time to send out the medication to the patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquis from warfarin. So again, it depends on the INR level, so we can have the patient switch from warfarin to Eliquis from the outpatient setting. So if the patient inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the INR to make sure it's less than 2 before start taking the Eliquis. It's most easier for the patient to switch to the Eliquis when they're still at the hospital. But if the outpatient management, then you need to stop the warfarin for 2 days if the INR at the therapeutic level, and then start the Eliquis to make sure the INR less than 2. If the INR a little bit high, like 3.2 or 3.3, then I would recommend to stop the warfarin for 3 days prior to starting Eliquis. But what happens if the INR at the really high, like 3.6 or above, in the time visit, then I would recommend I would reduce the dose or take a partial dose and then retest iodine in 1 week to make sure iodine level therapeutic before switching to the elements. And when the iodine at the therapeutic level, and just try to hold 1 or 2 days prior to the aliquot, prior to starting the aliquot to make sure the iodine is the COVID-19 caused VTE, the venous thromboembolism, the DVT or PE, deep vein thrombosis or pulmonary embolism. You can go to Google, you can type COVID-19 cause VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, the DVT or PE. So, and then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience decoagulation disorder. And then in the following website, BostonMedicalJournal.com, is also show that COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 might cause the venous thrombosis. So, I have experienced some patients who have the COVID vaccine and they experience the increase of the iodine. So the COVID-19 vaccines might increase the iodine number. It's not much. It's about between 0.5 to 1. For example, people who normally have iodine around 2.5, they may increase the iodine to 3.0 to 3.5 after vaccination. So, but it not last long. Usually they experience the iodine increase in about 3 to 4 weeks. After that,